It's quite similar to the PLAB exams that you might have heard of in the past, or some of you might have sat. Um, so it's basically a multiple choice exam that's given by the GMC that all medical schools in the UK have to sit from next year. So I sat a pilot exam this year, which was 100 questions over two exams, which is slightly different to the international one. But it covered a wide range of different topics, which we'll go on to a little bit later. I thought for me it was okay actually. I'd done exams similar to it throughout medical school, multiple choice exams, and it was reasonably similar to the exams that I'd done before. Thankfully, I found out the other day that I'd passed, and so it's all good. And so yeah, next slide, please. So the changes are, so if you're wanting to sit the UKMLA, it's going to start in August. Um, and the first sitting of the UKMLA is on the 8th of August this year. So if you are looking at the PLAB 1, PLAB 2, instead of sitting the PLAB 1 or PLAB 2, you would sit the UKMLA. If you've already sat PLAB 1, you still have 2 years to sit the next part. So instead of sitting PLAB 2 from August, you'll sit the CPSA, which is the clinical exam, which goes alongside the AKT. So the UKMLA comprises two parts. It's the multiple choice questions in 180 multiple choice questions, and also a clinical exam, which is an in-person exam that's testing your clinical skills in history taking, examination, and procedural skills as well. So looking forward, so there's still one more sitting of the PLAB exam, which is in May. That's on the 23rd of May. After that, all of the exams will change to the MLA format. So any of you here, have you seen the MLA content map? Just give me a thumbs up or a yes in the chat if you've seen the content map. Yeah. Some of you know what I'm talking about in terms of, yeah, cool. What the content map is. We'll go over that in a few minutes, but the content map is really a good tool in order to help you know what you need to know for your exams, because that's the skill, that's the hard thing to figure out what you actually need to know. Okay. So as you can see, these are the dates of the UKMLA exams coming up in the next year. So you're able to schedule one of them. So these will be sat in exam centres in the UK, so in Belfast, Birmingham, Cardiff, Edinburgh, London, Manchester, Newcastle, Oxford, or Sheffield. You can also sit it in Dublin in Ireland or in Madrid in Spain. And internationally, you're able to sit in Australia, Bangladesh, Canada, Egypt, Ghana, India, Kenya, Nigeria, Pakistan, Ireland, Saudi Arabia, South Africa, and Sri Lanka and the UAE. I saw that a lot of you from the UAE, so that's quite helpful. Okay, so just having a little look, comparing the two, the PLAB exam, which has been going on for years, and the UKMLA, which has been brought in recently. Um, so these is kind of comparing the differences. So as I said before, the difference between the two exams. So that they're not going to be using the PLAB blueprint anymore. They'll be only using the MLA content map. And it'll be a very similar exam to the to all graduates. So no matter where you're from, if you're from the UK, if you're from abroad, we'll all be sitting the same exam as a licensing exam. The exam itself is pass fail. What I mean by that is the way in which it's used is they have a cut-off in terms of a pass mark, which is what's used. So you either pass or you fail. If you do really well, that's great, but it doesn't determine, you're not ranked using this exam in terms of where you might go in the UK or where you might go. The UKMLA is only set out to be to have a baseline of medical knowledge that they're looking for. So Yeah, I've kind of spoken about this already. You might be familiar with OSCE style question format, which is clinical exam. Often it's about 8 minutes a station. You might have kind of 16 stations where you're tested on various clinical histories, clinical examinations, um, and we'll go into the ins and outs of that exam at a later date. Okay, so as I said before, this is the slight differences between what international graduates will sit and what the UK graduates will sit. So if you're an international graduate, you'll sit 180 questions. It's all in one day and it's paper based. Um, and it's a single best answer questions. So I'm sure you'll have done multiple choice questions in question banks. So it's really important to kind of have a good understanding of how to best approach single best answer questions, different strategies, and also having kind of the clinical understanding and knowledge to be able to answer those questions. The CPSA, that is the clinical exam, which will be in person. There'll be an examiner who will examine you on your skills, taking histories from various simulated patients, and that'll be something that it's really important to practice for. I think for the clinical assessments, I sat OSCEs, as it's said there, which is just another word for it. I sat them recently, and the best advice I can give you is practice, practice, practice. Getting a few friends and just running through practice examples with them, practicing history taking with them, talking through examples of what could come up in these exams, having a good understanding of what you need to know, and then being able to practice and practice. Because when you've done it many, many times, it'll come naturally to you, and you'll be able to kind of fly through the exam reasonably comfortably. Okay, so looking at the MLA content map. So if you look on the MedPrep website, they have the MLA content map as a PDF that you can download that you can have a little look at. And it has in the content map, it's split up into lots of different sections. So these sections that we're talking about here, so number one being the areas of clinical practice. So that's things like whether it's split up into surgery, split up into medicine, split up into different domains like mental health. So they will kind of put the different conditions in the content map, which are relevant to different specialties or different clinical areas. The areas of professional knowledge. So that's thinking about the types of knowledge that you'll have. So thinking about biomedical sciences, ethics, law, um, kind of potentially pharmacology, all those different kind of areas that you might have learned in medical school. So then you've got your clinical and professional capabilities. So this is more linked to the guidance given by the GMC, so the General Medical Council, about what they feel medical graduates in the UK should know. Um, then you're thinking about things like patient presentations, so looking at the signs, symptoms, investigating certain conditions, how those conditions will be treated, and for example, how you'd manage a breast lump, how you'd manage a rash, all these different things. Um, and then last and not least, conditions. So there's a list of conditions that you could be tested on. Obviously, there are some conditions that you're more likely to be tested on than others, but it's really important to have a brief understanding of all of the conditions, and then you'll need to go into more in-depth understanding of the more common conditions that are more likely to come up. So, as I said before, there are 311 conditions that can come up on the UKMLA, which seems like a lot. But if you think about it, when they're testing something like heart failure, so a condition like heart failure is very common. They'll want you to know the ins and outs of heart failure, the presentation, diagnosis, the severity of the condition, thinking of things like the New York Heart Association classification. to look at severity. You'll also be looking at reasons for treatment, maybe why different people will have certain treatments and which treatments help symptoms and which treatments help prognosis as well. But in comparison to a condition such as something like mumps, which is also on the content map, mumps is less common. What they'll want from you to know knowledge-wise for the UKMLA, they'll want you to know things like how it presents, how it's diagnosed, and then the treatment. They'll not want you to go into as much detail because it's not as a condition that it will come up regularly in your practice in the UK. So this is just an overall list of the different clinical areas, so different clinical specialties, looking at things like acute medicine, all the way down to things like renal and respiratory, sexual health. So there's a wide range of different medical specialties that will be tested. From my experience from the pilot that I set it 3 weeks ago. They have a wide range of topics, but it doesn't test you necessarily um, really deeply on those on each of the areas. It's more it wants you to know about everything, but you don't have to know everything about everything, if that makes sense. You just have to have a good understanding of the different things that you need to know. And the content map is really good at splitting up things that are important for you to know. Okay, so this is following on from that, just a few more on that list of areas of professional knowledge that are important for you to understand in studying the UKMLA. Okay, so thinking about the different conditions that can come up, it's really important, first of all, I'm sure you'll have all had classes about pathophysiology of the disease and clinical diagnosis. So it's really important to link the kind of theoretical knowledge that you've learnt to how that will help you in clinical practice. So thinking about the guidelines. So in the UKMLA, there are a few questions about what's the next best kind of treatment path for this patient. And so you'll need to have a reasonable understanding of the NHS guidelines, so NICE guidelines, what things need a 2 week wait. So, for example, a man coming in with blood in his stool, if he's a 60-year-old man, that'll be different to if he was a 40-year-old man in how NICE guidelines want you to refer him if he came into you in general practice. So having a little look at what those 2 week wait guidelines are really important. So not only knowing kind of the kind of pathophysiology of the disease, but also knowing how in practice as doctors you'll be treating patients according to the kind of nationwide guidelines. Okay, so here's a list of the top 10 conditions like that are tested in the MLA. So it's obviously not an exhaustive list. They test you on a lot more than the 10 here, but it gives you a good idea of things that they've tested, that a lot of their MCQ questions will be kind of focused on because these kind of conditions like anemia, stroke, heart failure, obesity, very, very common things that you'll face in day-to-day practice a lot. And so they come up in the multiple choice questions quite regularly. And one of the skills of the MLA, I think, was most useful for me was looking at the different conditions and maybe types of anemia, for example, and think about how each of those types of anemia were different from the other types. So being able to differentiate between different conditions is really, really important. And it's one of the main skills, I would say, in the AKT is being able to, when you're reading the question, having an idea, oh, I've seen because you've done lots of multiple choice questions in the past, you'll look at the question and you'll be able to identify key points in the question and be able to distinguish between what potentially you're thinking about and what could be going on with the patient talked about in the question. Yeah, so this is a good list of like the top 10 conditions because anemia and heart failure, stroke, if you look at the different specialties, so they can be tested in lots of different specialties, and obviously you have things like child health and pediatrics, which will kind of repeat some things, but also will have specific things to pediatrics that they'll be wanting to test you on. Okay, so in the content map, when you have a little look at it, it splits it into presentations. So how a patient will present to you, whether that's shortness of breath, whether that's vomiting, chest pain, kind of these classic presentations that will come up and things that you'll see. Um, so how they'll appear clinically. They might also give you blood test results. They might give you an image, like an ECG or something like that, that will help you kind of understand a little bit about what's going on. So they split it into presentations and conditions. So you kind of can think about these two things differently. So the presentations, you want to, when you see a presentation, whether that be chest pain, what are you thinking of? Anyone, any thoughts? Give me some suggestions of things you'd be thinking of. If I said to you chest pain, give me some differential diagnosis of what could be going on with some random person with chest pain. Yeah, MI, great. Any other things you could be thinking of with chest pain? Pericarditis, angina. Right, fantastic. Yep. PE, absolutely. Yep. Pleuritis, great. Yep. So you can think about them in different ways. I like to think about them in systems. Yep. Great costochondritis. Perfect. That's a good one. So you can think about them in different ways. Lots of people have different ways of doing it. I like to think about them in systems. So thinking about respiratory, so things like kind of pneumonia, chest infection, those kind of things. Whereas it could be more cardiac related, MI, pericarditis. You, it's important when you're thinking about the different presentations to have, I would say, at least five different things that you can think of for each thing. With chest pain, you'll want to be able to name a lot of conditions that can cause chest pain. With other more niche presentations, less common presentations, or less serious presentations, you might know fewer conditions that cause those presentations, but I think to have a reasonable understanding of what can cause that presentation is really, really important when thinking about um, those different presentations that are listed in the MLA map. The other side of it is the conditions, which we've kind of talked about already. Just having an understanding of what those conditions are, how they're caused, and then diagnosis and treatment, and how they would present to you. So these are the kind of the top 10 presentations that are tested in the MLA. Um, so if you're thinking about things like breathlessness, very, very common. Lots of things cause breathlessness, and lots of things are more likely to cause breathlessness at different ages, different demographics, different sets of patients. So it's really important when you're reading the multiple choice questions that you read in for who it's talking about, how old they are, what risk factors they might have, what's been going on, the actual nature of the condition, what details it gives you, what negatives it gives you. So it might say they've got breathlessness, but they don't have chest pain. They've got breathlessness and they've got a cough, and the cough is productive. But there's no blood. So what things are you thinking about in those situations? So going down the list, so you got breathlessness, trauma, types of trauma, what you do in different situations, thinking about so if there was a head injury, for example, what would you do in that situation? There's a really good list of things in terms of whether you get a CT head, whether someone has lost consciousness, the number of times that they've been sick, whether there's been a break to the skull. Those kind of things will influence whether someone needs to have a CT head now, or whether they need to have a CT head a little bit later, kind of the urgency that someone would need to have that kind of investigation. So going down the list, thinking of fever, managing acute and chronic pain, chest pain, electrolyte imbalances, cough, high blood pressure. and headaches as well. So these are really common presentations that you'll come across, and I'd say these top 10, you should have a good list for each of them of things that you're thinking about could be going on for each of these presentations. And it does seem like a lot. Kind of when you'll go through the content map, you'll see 300 conditions, you'll see all these presentations that you're expected to know about. But the more practice you do with practice questions, and the more you're kind of looking at your history taken in your examination, the more you'll be able to understand what's most important to you, for you to know a lot about, and what's less important to know a lot about. And so that comes with time as you practice, and the closer you get to your exams, the clearer those kind of lines of what you need to know and what you don't really need to know will become clearer to you, and we'll be able to help you with that through the different courses that we offer, and also the online platform that you've access to get to this webinar. So this is a kind of a typical question. So a 45-year-old male presents to the emergency department with sudden onset chest pain radiating to his left arm. He reports feeling diaphoretic and nauseous. On examination, his blood pressure is 160 over 100, heart rate of 110, and he appears distressed. Which of the following conditions is most likely to be responsible for this presentation? So I'll give you a few seconds to think about that. But yeah, put your answers in the chat if you for what could be going on here. This is a reasonably straightforward question. But if it's not, if you find it a bit difficult, that's all right. It'll come with practice. But yeah, if you want to put it in the chat, or if yeah. So I've seen it already. There's someone who said, yeah, MI, perfect. So C is the right answer. Yeah, so that's an example of a best answer question, and kind of the format of a typical question that you might see in the AKT. So in terms of the format of the exam, the AKT, they will be looking to test your kind of your theoretical knowledge, and also your knowledge of things that might come up in practice. So there are in the exams that I just sat, there was about 5 questions which were on like ethics and law. So there was one question which was talking about a patient who had died a few hours after after being discharged from hospital, and it talked about what were the best steps in order to do. So in the UK, there's something called the coroner, which is if there is a suspicious death, or if there is a death that could have been prevented. So if someone's discharged very quickly after being discharged from hospital, that might be referred to the coroners. And similarly, if someone is admitted to hospital within 24 hours and then they die, they would then need to be that would need to go before the coroner. And the coroner is someone who looks at something legally and will be able to make a judgment on where all of the correct medical things followed. And so there are examples of questions like that, which are less kind of medical knowledge and more practical knowledge that you'll need to know as doctors in the UK. So yes, and there's also things like statistics. You need to have a reasonable understanding of statistics. With the UKMLA, there is more statistics, I think, now than there was before. But in the pilot exam that I just sat, there wasn't any more than no, there's probably about 3 or 4 questions onto statistics. I was a little bit worried going into statistics, thinking about what I need to know, and because I didn't really have a particularly good understanding of statistics going into the exam. So when I got into the exam, I actually started writing down a few formulas. I didn't actually need the formulas, so I was all right. But yeah, just having a reasonable understanding of statistics, and in doing practice questions through various multiple choice banks, you'll be able to have a good understanding of what statistics you'll need to know. And also, because I was probably over prepared for the statistics, the ones in the exam were easier than I thought they were going to be. So yeah, so yep, so kind of how we can help you. I think Nabil might be talking to you about that. So I'll hand it over to Nabil.
So yeah, I'm just going to talk about like Mark said, like how we can help you with this process of taking the UKMLA exam. And I think first I'll start with what you guys will need to do, and I think John has already mentioned this, is that the first thing you need to do is familiarize yourself, with the format and the content of the new exam, which will be based on which is like outlined in the UKMLA content map. In terms of the content, like most of it you would have covered already in medical school, but I think the key thing is understanding what you need in particular, so that you're not, revising things like over the top, or like not revising things, not to the extent that they want. And also like tailoring that sort of knowledge to the UK NICE guidelines, which is what the exams are going to be based on. So how can we help you with that? Well, we have our online course and lectures, which will help you with familiarizing the content and learning the content in the style that you'll need to know for the exams. And then the second thing that we do is going to offer online course, in-person courses in various locations. The second thing is like, and this is probably the most important thing, is practice, and practice like number of practice questions, because I think the general consensus among UK graduates is, whilst there are like a lot of practice questions out there, there aren't many that are tailored exactly to the new style of UKMLA. And so what we offer is 4,000 multiple choice questions, which are written by experts in the field, which completely match the UKMLA exam itself. So they're tailored to the content map. So you won't have to waste time with things that you won't come up, or worrying about things, whether you're learning the wrong thing, or whether you're not learning the right thing. All these questions reflect the exam itself, and they'll all be available on our online portal. And then we also offer practice tests, which simulate the real exam itself. So yeah, you can go over them in time conditions to really hone in your revision. So we're offering for some of you who may be joining us from India, we've got a 2-day intensive UKMLA face-to-face course with experienced tutors who will help you and talk you through the UKMLA in person, helping you familiarize with the contents, and also going through what style of practice questions you need. With the practice, I mean, it becomes sort of pattern recognition, and the more questions you do, the more you like familiarize yourself with the style of questioning that they use in the UKMLA. And then you can see things in the prompts that will trigger you to get to an answer much more quickly. So yeah, we're holding that. If any of you are joining from India, there are more details on our website, which you can see, and we're offering a discount if you sign up early.
Thank you very much for taking the time to listen to us. I know there's a couple of messages in the chat, so we'll try our best to answer them. And if you've got any more, please pop them in the chat, and we'll take it from there. Thank you very much.